Hi, my name is Renee Chang, and today I'll be doing a presentation on human immunodeficiency virus and its effect on public health. Um, the problem existing in society is that over 36.7 million people are currently living with HIV, and 1.8 million of them are children under the age of 15. There's no hospitalization required per se because there is no cure, but antiviral treatment can be given to reduce the spread of the disease and slow the progression. The disease occurs when HIV attacks the immune system by reducing the amount of T cells in the body, and T cells are the cells that help to fight off disease and infection. So, because of that, it increases the odds of an HIV victim to contract cancer or other diseases. It's mainly a sexually transmitted disease, but it can be transmitted through bodily fluids such as blood transfusions and sharing needles. It can also be contracted from mother to baby, and in rare cases, it can be spread through oral sex. The disease occurs mainly in developing countries. Actually, over 95% of the HIV victims are from developing countries, and two-thirds of that number is sub-Saharan Africa, which is actually where HIV was first found. Etiological factors are that it is mostly in developing countries, as I said before, because they don't have the resources available to help with the disease. Gay, bisexual men, African Americans, Hispanics, transgender women, and injection drug users are also higher at risk from contracting HIV. Future risks of the community include the increase of HIV prevalence. So it is said that HIV will increasingly become more common over time, which then in turn more transmissions will be increased as well. Another problem is complacency, meaning that people are becoming complacent with HIV, which is bad because it creates lack of awareness and it increases risky behaviors that can increase the spread of disease and cause people to contract HIV. It also inhibits the goal of public health in reducing HIV within the community. Some strategies on how to solve the problem of HIV. The first one is keeping people educated about the issue. So that means just providing education about how to stay safe from this disease, such as safe sex, using condoms, um, and also information about how it's contracted to reduce the spread of it. Another strategy regarding medical states is pre-exposure prophylaxis and viral suppression. So that means that pre-exposure prophylaxis is basically when someone is higher at risk for HIV, meaning they have a sexual partner who already has the disease. So in order to reduce that high risk, they could start taking the HIV antiviral medication early so that they could reduce the spread of the disease or even prevent it. Um, Viral suppression is that it can reduce that viral suppression is reducing the amount of HIV in blood and elsewhere in the body to lower levels. So a cultural example regarding strategy one is from the Latino culture, and they have a video called Porque Si, which is a informational video regarding condom use. So it's a 20-minute video that is twice as effective in promoting safe sex. So it basically shows how to use a condom and how it can safely protect you from sexually transmitted diseases, especially HIV. And this show had shown to be twice as effective, as I said, and it reduces HIV morbidity and mortality in countries where treatments are accessible. Another example is the antiretroviral drugs in the 1980s that revolutionized the management of HIV. So, yes, there is no cure, but this certain drug helped to reduce the progression of the disease, which was very helpful, and that allowed more treatments to become accessible throughout the countries and reduce the spread or reduce the progression of the disease for those who have contracted it. So, public health in the future, literature says behavior changes and social marketing are both ideas that could help to reduce public health. So, behavior changes include stuff like practicing safe sex, using protection, because a lot of people are in denial and fear for some reason about using that, and also getting screenings and being honest with both your partner and yourself about whether you have STDs like HIV so that it doesn't spread further. Um, Also, social marketing, so making condoms more affordable and promoting the use of them is also super helpful in reducing how it can spread in the future. So, my personal opinion, I agree with both of these factors. So, behavior is, providing education and how it is transmitted from person to person, and how dangerous and detrimental it could be to both the community and individuals is really helpful in reducing the spread of this STD. So, education can be given in schools, on social media, really anything in order to educate the people about the transmission of the disease. Um, so, encouraging a change in an individual's behavior is also super important. Just like safe sex is important, also, like I said, those screenings and reducing injection drug use can help reduce the spread of the disease. But that all is helpful if those people change their behaviors to prevent this transmission, and how these transmissions can actually be prevented. And these are my references.